Department of Economics, it's a pleasure to be here with you guys again. And I bring you greetings from the Department of Economics. There are a number of individuals who've been working on issues of climate change. Uh, in this particular presentation, we're going to be looking at the impact on the health sector. Um, and I think, in reviewing the presentation, I think the most useful way that this might be of use to you all is to think about the planning that will be involved in figuring out how to deal with the impacts in the health sector. So the thought exercise therefore would be one, what are you guys, if you were planning and trying to map these things out, what type of planning needs to go into there to deal with climate change and its impact on the health? And how are you going to capture different dimensions, different requirements? So I think that's a useful way to, as we delve into the presentation, the outcome of this then would inform planning. So in terms of the particular presentation, it's broken into two parts. We're going to talk about the climate change impacts and vulnerabilities on health in the first component, and then in the second, we'll talk about the specifics of adaptation on health. Right. So I think this first slide here is a pretty good summary of a lot of what I'm going to say moving into the presentation, and it's probably a bit small for you all, so I'll take my time and go through the diagram here. But why climate change and health? And you guys are health practitioners, I imagine, or perhaps have done some work around health, and I don't think I need to convince anybody here about why climate change and health. But we certainly know that climate change poses significant risks to public health on a global scale. Climate change risks the health and health systems result from a combination of multiple hazards, diverse vulnerabilities, and multiple exposures and exposure pathways. So let's take a look at the diagram here. Right? So in the center column there, what we have are the climate-related hazards. Right? So the climate-related hazards would refer to extreme weather events, heat, sea level rise, air pollution, vector distribution and ecology, water scarcity, and reduced food production. So these are the, stemming from climate change, these are some of the climate-related hazards. Now, how does this relate to the health sector? Two ways. And you're going to hear this throughout the presentation. Exposure on one hand, and vulnerability factors on the other hand. So these climate-related hazards are going to interact with our level of exposure. So how are we exposed then? And how is the health sector exposed to these risks? Well, through people and communities, health workforce, infrastructure, energy systems, food systems, health systems, right? So our exposure comes directly from the climate-related hazards. But what's really interesting is the exposure also feeds back in terms of how we interpret, how we experience those climate-related hazards, and hence you'll see that it's an arrow that's pointed both ways to indicate that these two things play off of each other. So that's one important pillar in terms of how the climate-related hazards are going to bear on health systems and health outcomes. On the other side, we have vulnerability factors. And this as well interplays with how we experience climate-related hazards. So the vulnerability factors, for instance, would be demographic, geographical, biological factors and health status, socio-political, socio-economic, health system capacity, gender, and equity. So what we see, therefore, is that these vulnerability factors also determine to what extent climate-related hazards will affect health outcomes, and vice versa, because this is an interaction between these two pillars. Right? So we have the climate-related hazards, on one hand vulnerability factors, on the other hand exposure, that mediate the eventual outcome. And then yes, we have the eventual outcome, which is how does climate change manifest into health exposure. Right? So these systems interact, these different pillars interact with the health systems and facilities, and therefore produce certain types of health outcomes. And so some of those health outcomes would be injury and mortality from extreme weather events, heat-related illness, vector-borne diseases, and a number of different pillars that we have at the bottom here. Now, one of the main things to take away here, and for those of you who are involved in planning at the health sector level, is how interconnected all these different pillars are. It means that, and again, The thought process, the thought exercise I want you guys to keep in mind as we go through this presentation today is what type of planning do I need to engage in to effectively hedge against some of the effects of climate change. And this diagram here says that there are several different pillars that are interconnected that we need to keep track of and think about how they are interconnected in order to properly plan for the effects on the health sector. Right? In a recent publication by the Inter-American Development Bank, where they sought to aggregate current thinking, methodologies, and research surrounding the health impacts as well as the impacts on infrastructure, cities, and settlements. Well, this is the diagram that came directly out of that report. And in this diagram here, they're looking at the health and well-being impacts. So it's a summary table, really, but they're looking at the health and well-being impacts on the left side, and on the right side, the impact on cities, settlements, and infrastructure from climate change. And what you'll notice here, well, what's really interesting is that they compare global versus the effects we expect in Central and South America, as well as North America. Across the board, and I know we had a question earlier, where one member asked about the positive effects. In these particular contexts on the health impacts, what we see across the board is that they're negative, right? And in some cases, the darker symbols represent there's a high level of confidence that those are likely to occur in those particular regions. And so across the board, it's negative. So when we look at the impact from infectious diseases, heat, malnutrition, and others, mental health, displacement, they're all negative globally at the Central and South American level, at the North American level. And then when we look at the impact on cities and settlements, which also impacts health as well, we see that inland flooding and associated damages, flood storm-induced damages in coastal areas, damages to infrastructure and to key economic sectors, those impacts, current research is saying that those impacts are projected to all be negative. And in some cases, there's more certainty around the fact that there's going to be fallout from these. So current research then is underscoring that we should be bracing for these negative impacts. These are things that we need to plan for. Right. So we're going to look at vulnerabilities, some of the key impacts on health at a theoretical level, and this is at a global level. So how do we expect climate change, and in what way to manifest impacts on the health sector? Well, heat-related diseases, such as heat stroke, cardiovascular diseases, and dehydration. That's an impact. Air quality and respiratory diseases causing inflammation, blood clotting, and hypertension. Vector-borne and waterborne diseases such as malaria, dengue, yellow fever, increased Lyme disease via tick bites. Food and water security. So while this is not directly on health, but through a different mechanism, through food and water security resulting in food shortages, malnutrition, and increased susceptibility to waterborne diseases, particularly in communities lacking access to clean water and nutritious food. Mental health, and I've found many instances where this keeps popping up, and you'll see later on in the planning. Mental health issues which are increased through various climate change related effects such as fear, heat stress, and anxiety. Climate change is also pushing people to migrate in search of better living conditions. Climate change is damaging healthcare facilities and causing service disruptions, and of course, injuries and death from extreme weather events. So there are numerous ways in which these impacts come to bear on health systems and health outcomes. And this is not Trinidad and Tobago alone, but this is what countries across the world are grappling with and facing with and need to plan for. In the context of Trinidad and Tobago, climate change and the hazards can have different types of effects. But what is really useful in this particular slide here is the way we think. Again, remember, the thought exercise is how do we plan? How do we think about effects? And in this particular diagram here, it breaks it up between there can be direct effects stemming from these hazards as well as indirect effects, right? But even within that dimension of direct versus indirect, you can have short-term effects and you can have longer-term effects, which tend to also be different. So it means, therefore, that as we plan and as we think through these different pathways and how we become more resilient, we also need to think about whether it's in direct or indirect, and the time horizon that is involved, because these are likely to be different types of effects. So for instance, in the short term, the direct effects would be increased deaths and injuries from heat waves, elderly, infirmed, the young, and outdoor workers. Direct injury or death from flooding, landslides, or hurricanes. Increase in hunger and malnutrition from crop failure and increased food prices, as well as increase in respiratory morbidity and mortality from increased dust and ground level ozone. That's in the short term. Those are the direct effects in the short term. In the long term, we're talking about psychological effects through anxiety and depression from increasing insecurities and stress, increased coronary diseases and decreasing quality of life, and resulting increased stress. Trauma from permanent loss of homes, from inundation through sea level rise or increased seasonal flooding or landslides, and more respiratory diseases from reduced air quality. So you can see then that short term, there are significant effects, but those effects tend to be different of how we think about this longer term. And of course, the attendant policies would therefore have to be different when we talk about mitigating, well, adapting and being more resilient in the short term versus the long term. Those are direct effects. Let's talk about the indirect effects now. So in the short term, the indirect effects would be increase in waterborne diseases, diarrheal diseases, vector-borne diseases, dengue. I mean, we're grappling with, a bit of the dengue outbreak right now, but ongoing, this is thought to be something that we're going to continue to face a high risk for. Leptospirosis, also another high risk item. Lyme disease, malaria, in the case of malaria, that being a medium risk. So those are indirect short-term effects. Indirect longer-term effects would be physical and psychological conditions resulting from disease and increasing insecurity of food, water, food, and shelter. So you see, the psychological dimension is definitely playing out in the long term and needs to be a prominent part of the planning. In the context of Trinidad and Tobago, let's talk about some of the highest priority climate-sensitive health risks, right? And so on the right-hand side here, these are some of the specific ones that we're going to talk about. The first one is extreme weather events. Extreme weather events not only heighten the demand for emergency health services, but also jeopardize infrastructure of the healthcare facilities and disrupt service provision. Tobago is located on the edge of the current hurricane trajectory, facing increased vulnerability. And Trinidad, historically, although we have been less affected, in how climate events are changing, as we have seen in the most recent depression that turned into a hurricane that passed through the region and went on for quite a bit. These conditions are changing, and so although we have historically been less affected, we may encounter significant risks with more severe weather ahead. Those are, we have to brace for that, and we have to plan for those eventualities. Another high priority climate sensitive issue would be health related illness. Heat stress emerges as a pressing concern driven by escalating average temperatures and the augmented frequency and intensity of heat waves. Right? So the heat stress, again, it's coming through different characteristics that are changing. We have higher temperatures, but we also have a change in the frequency, augmented frequency and intensity of heat waves. Right? So there are multiple drivers that are producing the heat stress. It particularly impacts vulnerable demographics such as children, the elderly, and individuals with pre-existing health conditions. Heat stress impacts include heat rash, heat cramps, dehydration, heat exhaustion, heat stroke, and even death in extreme cases. So again, an important and climate sensitive health risk for Trinidad and Tobago. Now those previous two are on the direct side. Those are direct effects. On the indirect side, waterborne diseases. Increased flooding and extreme rainfall events can lead to contamination of water sources, and this contamination can lead to outbreaks of waterborne diseases such as diarrhea, cholera, gastroenteritis, hepatitis, typhoid, and a number of different types of situations due to disruptions in water treatment and sanitation systems. So these are indirect effects, and this is a high risk in our context. Food security and safety, so in particular food and nutrition security. Small island developing states, as we refer to as SIDS, confront unique challenges that render them susceptible to the impacts, particularly susceptible to the impacts of climate change on food and nutrition security. Disruptions to the agricultural production at a national level would affect food security and could lead to several different types of impacts. Could lead to higher dependence on food imports. As an economist, I already know that we have already a high dependence on imported foods. Disruptions in our agricultural sector can lead to an even higher dependence. And I mean, at an economic level, one of the policies that we try to wean off that high dependence on imported food, this is saying climate change is going to exacerbate that situation and keep us going in the wrong direction. So we may have an increased dependence on imported food, greater migration, which could affect food systems, and malnutrition. In the case of malnutrition, it's a triple burden that we face in SIDS, so characterized by undernutrition, micronutrient deficiencies, and overweight obesity within our population, alongside escalating rates of diet-related non-communicable diseases. So food and nutrition security, while it's not a direct effect, but it's certainly an important consideration and poses significant risk to health systems. Indirect effects, again, another high priority, vector-borne diseases. And I don't think I need to convince anybody here about, we're dealing with dengue right now. Climate change could impact the transmission of vector-borne diseases. Increased rainfall creates more breeding ground for mosquitoes, while higher temperatures can accelerate the development of the virus within the mosquito. So we're talking about more mosquitoes and then a higher rate of conversion to the disease within mosquitoes because of these multiple effects of climate change. Model estimates under various emission scenarios indicate that Trinidad and Tobago is consistently highly suitable for dengue transmission under all scenarios, thus rendering it vulnerable to outbreaks. So the outbreak that we're seeing right now is not just right now. Unless we take concrete steps, this can be an ongoing thing, for instance. Non-communicable diseases, and again, this is at a national health level, something that is costly and something that is a major consideration, particularly in our population. But climate change can exacerbate existing non-communicable diseases such as heart disease. So it can exacerbate some of the problems we already have. Existing non-communicable diseases such as heart disease, stroke, diabetes, chronic respiratory illness, often associated with unhealthy diets and sedentary lifestyles. And although the vulnerability and capabilities report does not explicitly address the link between climate change and NCDs, non-communicable diseases, it remains a critical consideration for Trinidad and Tobago's health sector as the nation faces those challenges posed by climate change. So it's not the links aren't explicitly drawn there, but I think this indicates ongoing work where we need, for health practitioners, we need to map out those links because these are important in resilience of the healthcare system. Factors, so we've been talking about the direct and indirect effects here, but when we think about planning, remember from the diagram at first we talked about exposure versus vulnerability and those factors. And the extent of both of those would determine, ultimately, in combination with the climate hazards, will determine what manifests in our population in terms of health outcomes. Factors increasing vulnerability. So vulnerability, the sources of vulnerability are tremendously important. When we're talking about facing climate risks, right? Working on vulnerability factors, therefore, plays a role in the manifestation of those risks and how it bears out. So there are several vulnerability factors: socioeconomic disparities in health infrastructure, demographic groups, and adaptation mechanisms. Let's take a closer look at each one. So the first one, socioeconomic factors significantly influence vulnerability to climate-related health hazards, exacerbating inequalities in health outcomes. So factors such as ethnicity, occupation, education, income levels all contribute differentially to vulnerability within our population. Right, so that's one umbrella vulnerability set of factors. Those are socioeconomic. Disparities, the second, disparities in health infrastructure, access to services, resources, and information contribute once again, to differential vulnerability across the population. Third, vulnerability varies across demographic groups, with certain populations, such as the elderly, children, and individuals with pre-existing medical conditions, being particularly susceptible to climate-related health risks. And the last one, well, at least for the purpose of this presentation, adaptation mechanisms encompassing both physical and social aspects, such as urban planning, building design, cultural practices. In other words, all of these different components that fall under that could be categorized as adaptation mechanisms, those are going to influence, the resilience of those will impact how we experience climate change. So these are important to note. Because again, in planning and trying to adapt, we need to be aware and we need to plan around these vulnerabilities as well. If we can reduce vulnerabilities, we therefore are likely to make progress to reducing the impacts that we face. And then there's a gender vulnerability dimension to all this as well. Climate shocks deepen the vulnerability of women, that women experience climate change due to pre-existing social, economic, and cultural inequalities. Natural disasters, and this is something that's coming in more and more in different reports and research. Natural disasters will lead to deaths of more women than men, with whether directly or indirectly through post-disaster events, all cause more women to die at a younger age than men. Right? That's quite shocking when I read it too. This gender gap is thought to be the result of discrimination against women, especially women living in poverty, since these disasters, adverse effects tend to disappear in high-income groups. So we see these effects in for women living in poverty and having unequal access to different types of resources in the economy. In high-income countries or groups, these effects tend to disappear. So the thought, therefore, is that this gender gap is an important consideration in where these disparities exist. Right? So what's the situation? So again, these are at a theoretical level. This is something facing vulnerability, facing countries across the world. This is something that they're all grappling with. Some specifics of the vulnerability factors in the context of Trinidad and Tobago. According to the same Inter-American Development Bank report, 55.7% of adults are obese, increasing health risks under climate stress. Children and seniors are sensitive to climate impacts. Uneven distribution of healthcare facilities affects emergency response during climate events. So what do healthcare facilities look like in certain parts of the country versus where we have health centers or major hospital systems? That difference in access is important in terms of vulnerability. Inadequate sanitation increases the risk of waterborne diseases. 22%, according to the report, 22% of our population have chronic illnesses, and 20% have disabilities, which heightens the level of vulnerability. And then there are the economic and social factors as well. High poverty, 16.7%, according to some estimates, and collective living, increased susceptibility to health impacts. Vulnerability to floods, landslides, and hurricanes threaten health infrastructure. So again, we've been talking about multiple impacts, multiple different ways, multiple different dimensions, and here we're also talking about another pillar that affects how we interpret and how we incur the health, the climate impacts, and that is vulnerability, and we see that we're vulnerable on a number of different fronts. The recent, so 2019 and the draft 2024 Risk and Vulnerability Assessment report for Trinidad and Tobago. Here we have sort of a framework. So what that report sought to do was to assess the level of vulnerability and the capacity within the Trinidad and Tobago context. The diagram, the table that you have here sort of gives a snapshot of how that was done and what was measured. And so this is being measured. So we have a risk element, exposure versus vulnerability. So what the report sought to do is to quantify to what extent there's a risk in terms of exposure versus vulnerability. And under vulnerability, we have two components. We have sensitivity versus adaptive capacity. Let's just talk a little bit more about each of these different elements. So exposure, to quantify there, indicators would have been used. And so the exposure indicators should measure the greater or lesser presence of health sector elements in Trinidad and Tobago that are exposed to hazards analyzed. So when we talk about the results later, there were exposure indicators that were used that capture that particular definition. On the vulnerability sensitivity side, indicators were also used there to quantify the level of risk. The sensitivity indicators should allow to analyze characteristics of TNT health sector that may imply an increase in climate risk. So population that presents intrinsic weaknesses that make them more sensitive to climate impacts, or elements that are dependent on climatic variables, example, agricultural land, food security. So those are, the thinking around the sensitivity indicators. Adaptive capacity indicators used to assess characteristics of Trinidad and Tobago's health system that may contribute to a decrease in climate risk for the sector, i.e. ability to adapt. So these measures that help addressing climate change impacts on the implementation, access to technology that helps dealing with climate change. Okay. So the vulnerability and capacity assessment report sought to use these different types of indicators to rate the level of risk in exposure and vulnerability. So we're going to pay it on a little bit more, okay? And again, the thought process, if you guys had to track or had to report on or monitor and therefore plan for how we adapt within the health sector, well, these are some of the type of indicators that you would need to use. So the first one we're talking about here is the exposure indicators, and some of them that were used in the report: the number of inhabitants registered, population living in urban areas, percentage of outdoor workers as a fraction of the total number of registered workers, healthcare facilities located in coastal areas, total number of health sector workers. Now these are indicators, but indicators are mapped to a purpose, right? So for instance, the total number of health sector workers, nurses, doctors, radiologists, etc., would speak to the quality and strength of the health system, for instance. The percentage of outdoor workers as a fraction of total registered workers would refer to that particular group that is vulnerable, more vulnerable and susceptible to climate change. So these indicators reflect different dimensions of the the exposure that we face, and so there are multiple ones in here, right? So in the table, these are the results based on the report in the table down here, and what we have are three types of risks: temperature, precipitation, and sea level rise. And so after the exercise was done, based on the report, we see that the risk to exposure from temperature changes is medium, what is categorized as medium, from precipitation level is medium, but sea level rise poses the highest risk, okay, in terms of exposure. So again, remember the framework here. We're talking about exposure versus vulnerability, and under vulnerability we have sensitivity and adaptive capacity. So we just talked about exposure. We're going to talk about the sensitivity indicators related to vulnerability, and some examples that capture different dimensions of that the sensitivity and vulnerability would be population density, proportion of children, proportion of seniors, number of homeless people, percentage of obese population, respiratory illnesses, and excess mortality associated with exposure to high ambient temperatures during working hours. Right? So those are some specific sensitivity indicators specific to the health sector, but there are also cross-sectoral indicators which may also be, were used and can be important as well. Cross-sectoral meaning have implications for the health sector as well as other sectors. So some examples of those cross-sectoral indicators would be variability in drinking water availability, food security and livelihood, vulnerability to climate change, groundwater salinity, and proliferation of pests and diseases, such as vector-borne, waterborne diseases, agricultural pests. Right? So these were some of the indicators that were used to quantify the level of risk in sensitivity. And we have the adaptive capacity indicators as well. So under vulnerability, we have sensitivity as well as adaptive capacity. So under the adaptive capacity, some examples of that type of indicator would be nurses per 10,000 people, hospital beds per 10,000 people, number of police stations, number of fire stations, distance to the nearest fire station. These are all examples of adaptive capacity indicators specific to the health sector. There are also cross-sectoral indicators, meaning important to health as well as other sectors, such as households with improved source of water supply, early warning systems in place, hard shoreline protection, mechanisms to ensure quality protection. Right? So there are a number of different indicators that were used, and once again, the table shows us the results from 3 different types of hazards, from rising temperatures, precipitation, and sea level rise. So for sensitivity, well, for all under sensitivity, according to the report, we have low vulnerability. Okay. On the other hand, our ability to adaptive capacity, appears to be very high in all scenarios, in all different scenarios there, particularly in the case of rising temperature. So combine then the sensitivity and adaptive capacity, what it appears is that our vulnerability to these particular type of hazards appears to be low. Well, according to this particular report. Right. So we've been talking about vulnerabilities, exposure, impacts on health at a theoretical global level, at a national level, and then how some of the elements that would be needed in terms of tracking and monitoring and planning. We're going to move on to the second part now, which is the adaptation on health. And health adaptation efforts are increasingly, so what does adaptation and health look like? Health adaptation efforts are increasingly focused on building climate resilient and environmentally sustainable health systems and facilities. So if we're doing it right, we're building climate resilient and environmentally sustainable health system and facilities. So that's what adaptation means. More specifically, it would mean and involve the development of climate-informed health policies. Right? So how does climate affect health? Climate-informed health policies and programs, management of environment and health determinants, emergency preparedness, prevention, and the establishment of robust health information systems. Right? So they are, in that latter definition there, in terms of what does adaptation on health, effective adaptation on health mean, there are 3 important pillars there: preparedness, prevention, and early warning system. Right? So under preparedness involves developing the knowledge and capacity of government, organizations, communities, and individuals to anticipate, respond, and recover from disasters. This is the planning that needs to go into there. To anticipate, respond, and recover. Right? It's one pillar. Prevention, activities and measures to avoid existing and new disaster risks. And the third pillar, early warning systems, comprehensive setup that monitors hazards, forecasts disasters, assesses risks, communicates alerts, and prepares people and organizations to take timely action to minimize risks before hazardous events occur. Right? So, in a snapshot, building adaptation in the health sector involves these components. How would one build adaptation in the health sector? How do we conceptualize, how do we think about? I mean, certainly we've been talking about so many different components that are integrated together. Simple answer is that we need an operational framework for building climate resilient and low carbon health systems. And so in the diagram here, we have several different building blocks that are important. And again, the thought exercise is, how do we plan? How do we conceptualize? How do we think about planning in, for adaptation in the health sector? So there are multiple actors that are involved, right, in adapting effectively. And I won't call them all out, but what we have here, climate smart health workforce is an important pillar. Management of the environment and determinants of health, climate-related emergency preparedness, health and climate research. There are several different components that need to be brought together to effectively plan and therefore adapt the health sector. Combined, this is what we refer to as the operational framework for building climate resilient and low carbon health systems. Adaptation in health sector. So what's been happening adaptation-wise in Trinidad and Tobago? Well, the Ministry of Health in Trinidad and Tobago has undertaken several initiatives aimed at enhancing the accessibility and quality of healthcare facilities across the nation. So there's been renovation, well, you guys probably know much better than I do, but renovation and construction projects to modernize and expand existing health centers, as well as establish new facilities to meet healthcare needs. Importantly, the Public Health Inspectorate and the Insect Vector Control Unit agencies play a critical role in safeguarding public health through activities such as monitoring environmental conditions, controlling risks to human health, implementing vector control programs. Right? Now, these units directly related to preparedness, prevention. Right, these are important parts of what a proper adaptation planning would look like. Right. One key initiatives, again, in Trinidad and Tobago, the 5-year National Strategic Framework and Action Plan for Non-Communicable Diseases, 2017 to 21, laid out 4 strategic priorities for implementation. Right. First is risk factor reduction and health promotion. Secondly, integrated and comprehensive care and management for non-communicable diseases. Third, surveillance, monitoring and evaluation and research. And fourth, governance, policy and advocacy. So there was a development of guidelines for the management and of prevalent NCDs by RHAs and capacity building for healthcare workers within the RHAs. Government has also launched public awareness campaigns to educate and motivate citizens to make healthier lifestyle choices. In the National Adaptation Plan, 5 strategies have been included for health sector, which focus on enhancing the resilience of the healthcare system. Right? So the first is a hazard mapping to identify countrywide and site-specific risks to the health sector. Develop and implement climate change preparedness planning and a public health education program. Thirdly, undertake an interagency and utilities climate change risk assessment with a focus on health service delivery and health infrastructure. Fourth, upgrading of drainage infrastructure. And the fifth, improve climate change risk management within health service delivery, including built-in redundancy. Right? So these are 5 strategies. Let's just take a look at one, okay, and the thinking surrounding that particular one. So we mentioned here upgrading of drainage infrastructure, right? So that's the particular strategy. How do we implement? So the recommended implementation is to assess the deficiencies in the drainage system with particular focus on drains and riverbanks, develop and implement plans to address the identified deficiencies. So notice that we have a strategy that is linked to how we implement, and that's also linked to the impact, what would be the impact of this particular strategy on resilience. And in this particular context, upgrading of drainage infrastructure, that is likely to lead to reduced flooding and water-related health issues, which we saw was a major source of exposure and vulnerability, improve sanitation and health conditions, enhance resilience of communities to climate-related events. Right? So in terms of the planning then, we have strategies, but those need to be linked to how we implement and what are the likely impacts to resilience. Right? So I think this brings me to the end of the presentation.